Do you know why the GLP-1s were studied for weight loss?
There's a post up on my Instagram Reels uh, talking about someone else talking about some of the lawsuits surrounding some of the things, the injuries happening with GLP-1s. And I'm not going to get into that because the side effects were discussed. If you didn't care to hear the side effects and you were one of the people that suffered, I'm really sorry. Um, if you are one of the people who can never come off of it because you've never actually learned how to eat properly, also really sorry for you. You should never be on these consistently because you will cause GLP-1 resistance, and once you do that, you are in serious trouble. But let's for a moment just look at this. The starting dose always starts out about the same, right? But the starting dose of 0.25 milligrams weekly usually stays there for 6 to 8 weeks before they move it up. And they ask people to also do movement and nutrition challenges in order to change this. The usual dose is 0.5 milligram to 1 milligram a week. The max dose is 2 milligrams a week for someone with diabetes. Now, in the weight loss side, the max dose is 2.4 milligrams per week. The weight loss dose can be up to 140% higher than for a diabetes client. And this is because of the appetite suppression part, and this is for semaglutide. Let's go to it. Liraglutide, starting dose 0.6 milligrams daily. The target is 1.2 to 1.8 milligrams daily. The weight loss, Saxenda, the titration up to 3 milligrams daily. Weight loss dose is 2 times higher. That means 2 times the side effects. There's some other ones that we could go through, like tirzepatide, and again, the doses on those are like 3 times what they would be for someone who has diabetes and is managing insulin resistance. But this is also to tell you that the starting dose for most people when these pens came out was way too high for what their body could handle and not have side effects. But here's what they say is important clinically. Titration speed matters more than the dose alone. So you actually have to do the changes in movement pattern, and you have to do the changes in nutrition and nutrition timing. I will tell you that makes a difference in order to see differences and know if you're truly hitting a plateau or if you're giving up too early on your dose and looking for side effects. Protein intake and resistance training is critical, not optional, critical. Weight regain risk is common if medication is stopped without lifestyle support. That means weight training, it means movement every day, it means eating correctly every day and understanding what your body needs. Metabolic versus cosmetic use benefits strongest in patients with insulin resistance, type 2 diabetes, mellitus, or metabolic syndrome. This is not a drug you play around with. And I understand that the dosing for diabetes clients was way less than it was for weight loss clients, but the reason they studied it, the bottom line, they were studied for weight loss because patients were seeing significant weight loss results in diabetes trials, meaning the lower doses work. And they work at a healthier, more meaningful speed long term for your success and overall health and well being. It is perfectly safe and normal to lose 1 to 3 pounds a week. In your first couple of weeks, when you start losing weight, or like in the middle there somewhere, as your body starts recognizing, hey, I don't have to hold on to all this inflammation, you may have a week where you lose 5 pounds, but you should in no way be losing 10 to 20 pounds a week. That's dangerous. And if we know a drug worked for weight loss at a quarter of the dose, at half the dose, at 50% of the dose, why the heck did we go mess up a good thing when less people had side effects at those lower doses? And in fact, the issue with the retinal nerve, the optic nerve degeneration, didn't even come up as an issue until these drugs came out for weight loss because the doses are too high. And I'm not saying don't use these drugs because there are, and I have some concerns that I want to dig into the research on Retta. And if you're taking Retta, you are taking gray market. It is not out yet. Like it's gray market, and that's totally up to you. Just choose a reputable source. That's on you. It's on you. But know that you're also going to have to communicate to anyone who provides care for you that that's what you're doing. And I want to dig into that research a little bit more. I want to look at the data. I want to look at some of the things that they're reporting, because one of the things that these other dual action ones do is they actually lower the release of glucagon. But what Retta is saying is that in some cases it elevates it. And that could be a problem, because then glucagon tells the body to release sugar, which tells the body to release insulin. And that's a problem for diabetics. But the anti-inflammatory benefits, the loss of the brain fog, because hey, it's inflammatory. It's also a blood sugar issue. Alzheimer's is diabetes type 3. That's already been stated in literature. The decrease in autoimmune symptoms, the decrease in autoimmune flares, all of that stuff is legit. It's being shown in the research. They're even reducing osteoarthritis, knee pain in clients who are losing weight. And that primarily is due to the weight loss, quite frankly. But part of it is due to the fact that it lowers inflammation throughout the body. However, the lifestyle factors are critical. They are not optional. And you should start the lifestyle factors when you start the medication, if not 6 weeks before, because otherwise you're going to have trouble. You cannot, as a woman over the age of 40, lose 30% of your soft tissue mass, your lean tissue mass, and be okay when you're 80. You can't. It's too hard to build it back. You cannot lose 80% of your lean tissue as a male and have a healthy testosterone level. You cannot. There's signaling there that happens that tells your body that it needs more testosterone. You cannot have health if you are still sucking down alcohol all the time and eating whatever you want because your body finally knows how to burn carbs. If you taught your body how to be metabolically stable, it could burn carbs and stay in a metabolic state of ketosis, and have you healthier all the way around without needing the medication. And the goal of any medication should be able to come off the med. Come off. So if you're just ordering and you're getting gray market and you're not working with someone on nutrition, or you haven't in the past worked with someone on nutrition, and you're not making sure that as a female you get a minimum of 90 grams of protein in a day. If you're trying to build lean muscle, you want to probably get closer to 120. And as a male, 150 grams of protein a day. And if you want to build muscle, you probably want to closer to 180. And you're not getting some good, healthy carbohydrates in from vegetables every single day, and you're skipping your starches maybe all but twice a week, unless, and this is a big unless, right? Because your genetics and my genetics are not the same. If you're of Asian descent, you may benefit from eating rice most nights of the week. That's a healthy version of rice. So you cook a big pot at the beginning of the week and you eat the leftovers for the rest of the week, because now it's a resistant starch. And if you're not drinking enough fluid, shame on you. And every single patient who's on a GLP-1 should be using a liquid liposomal multivitamin, liquid liposomal vitamin D, and a digestive enzyme with your biggest meal and right before you go to bed. And this isn't when I think your biggest meal should be. This is research driven. Your biggest meal should be the one that wake up time happens. Your biggest meal should be within that first hour of waking up, because if you drive cortisol up, you drive the release of glucagon, which drives the release of sugar, which drives the release of insulin and drives insulin resistance. Research based. If you're looking for someone to help support you through your weight loss journey and you're using GLP-1s and you don't want the judgment to come with it, you want understanding and knowledge and how to work it so you can get off this medication, click the link.